South Florida today on NBC6 HD.
Well, Botox is commonly known to smooth fine lines and wrinkles, but a shot of Botox may do more than erase the furrow from your brow. It may also aid in the relief of pain. Studies show Botox injections may reduce chronic back and neck pain and headaches. Dr. Ronald Demeo, a Coral Gables pain specialist, is here today to tell us about the medical benefits of Botox. And the name of your place is Meridian Spinal Therapeutics.
That's correct.
Right? I was unaware of this. I knew, of course, about the wrinkle aspects and about helping with spasms. When did you start at your clinic using Botox for pain relief?
Well, I started using it actually when I was doing academics. I was the assistant professor at Baylor College of Medicine in anesthesiology and interventional pain medicine. We started working with Botox in the early 90s as a joint venture with the Department of Neurology for the relief of spasticity through conditions called torticollis for spasticity of the neck in children. We were injected into the muscle itself, and we're getting good relief of spasm and pain, and then we start using it for migraines and so forth, injecting across the forehead, and that's when the cosmetic aspects were realized. But when we injected the Botox across the forehead, we noticed some wrinkle reduction, and then that launched the cosmetic side. Mm-hmm. And over the years, there's been a de-emphasis on the therapeutic side, the medical side, and more of an emphasis on the cosmetic side. But it's actually a very useful modality for treatment of chronic pain.
Well, let's talk about what kind of pain can be helped by using Botox injection.
Well, Botox is primarily used to relieve muscle spasticity. It's a selective blocker of muscle. So you can inject it into, say, a muscle that's in spasm. You relieve the spasticity without creating any numbness or analgesic effects in terms of like a local anesthetic would. And it's actually long-lasting. When someone gets, say, a disc herniation and the muscle shortens and goes into a spasm.
And I've had that, and it was probably the most painful thing I've ever had in my life. How would Botox help that?
Well, after the disc is herniated, the muscles around the disc get shortened and go into spasm. And so even though the herniation is over with, the result of which remains, such as the spasticity. And that limits range of motion, it limits exercise potential, it keeps people in chronic pain taking muscle relaxants, narcotics, and so forth. So what we have done basically is if you take that patient who is not recovering appropriately, still has a lot of spasm, a lot of pain, we can simply inject the muscle with a solution of Botox.
Where it connects to the back, to the spine?
Exactly. You can palpate the muscle, either palpation or through an EMG, inject and actually find the muscles that's in spasm, inject it with Botox selectively, and cause good, profound muscle relaxation and good pain relief.
Is the relief instant?
No, it takes about a week to start to see the effect. Similar to Botox in the cosmetic realm, would take several days to start to see the effect. We generally see the effects start to happen in 1 to 2 weeks. And the amount of Botox required is a lot more than you'd see in cosmetic. For instance, if we would use, say, 100 milligrams or units of Botox into the face, you would probably need several hundred into the back and neck. Mm-hmm. Because the
but you can get somebody off heavy drugs, and you need heavy drugs for bad back pain.
Absolutely.
Is there a downside? I mean, is it possible that you're going to lose sensation or feeling in a leg because of this?
You can get excessive weakness. So you have to basically inject the muscles that are not. We want to inject the muscles that are used for, say, posture, and so the closer to the skeleton as possible. You want to be careful about injecting into the muscles that are used for walking, for instance. Right. You want to be able to stand, and you have to make sure you don't over-inject, because then you can create excessive weakness, and then that defeats the purpose.
All right. How long will an injection like this, if it takes care of the pain, how long will that last?
It can last anywhere from 3 months to a lifetime, because once the muscle is no longer in spasm, then the body can then rehabilitate.
It tends to start going back to normal anyway, and if your pain is relieved during that process, you've won the victory.
Yeah, it's not just pain relief, it's also increased range of motion, which is the mainstay of therapy, is physical therapy. If we can get the body to rehabilitate and get good range of motion and complete range of motion, we can get faster recovery.
Is this modality covered by most insurance policies?
Yes, it is, including Medicare, and it's FDA approved.
All right, doctor, thank you very much. Fascinating stuff.
Thank you.
Dr. Ronald Demeo's office is located at 6 Aragon Avenue in Coral Gables. Again, it's Meridian Spinal Therapeutics.
All right, well, we're keeping things in Coral Gables because coming